Hundreds of thousands of hand disinfections are carried out daily in hospitals, doctors' offices, laboratories, and outpatient clinics in order to prevent the spread of germs and thus reduce the chance of infection for patients and healthcare workers. Each and every hand disinfection is important because every hand disinfection contributes to protecting ourselves and our patients from infection by a pathogenic, that is, disease-causing agent. Nosocomial, or hospital-acquired infections, arise primarily due to bacteria, fungi, and viruses, and are reduced by consistent practice of professional hand hygiene. This is because each hygienic hand disinfection kills or inactivates any microorganisms that may be on the hands. This way, hands that may have been contaminated with pathogenic organisms can be used again for the many aspects of patient care without passing on these germs. The basic requirement for correct hand hygiene is the availability of the proper facilities in the healthcare workplace. Cleansing areas for the staff must be equipped with dispensers for alcohol-based hand rub disinfectants, wash lotions, and skincare products. Various types of dispensers are available. You can choose from a dispenser with an integrated dose pump in either plastic or metal. And the metal dispensers are optionally available with an extra long arm lever. Alcohol-based hand rubs are extremely effective antiseptics. An additional advantage is that they can be used almost anywhere, independent of water and sink. For example, at bedside, from a dispenser on the edge of the bed, from a pocket bottle, or at the entrance to every patient's room. This way you can disinfect your hands at any time without going out of your way. Alcohol-based disinfectants save time, are easy to use, and thus lead to a substantially increased compliance. To be fully effective in a short time, the antiseptic has to have a sufficiently high alcohol concentration. Personal hygiene includes keeping the fingernails short, clean, and well cared for. Nail polish and artificial nails cause problems in maintaining hygienic hands. They tend to become chapped or damaged, and thus encourage colonization with microorganisms. Wearing jewelry, in particular on the hands and lower arms, should be avoided at work for hygienic and safety reasons. Washing your hands, in addition to using an alcohol-based disinfectant, should be done only at the start of a shift, after using the lavatory, or when the hands are visibly dirty. In the course of a day, performing the hand disinfection without washing is fully sufficient. Additional washing would only cause the skin to dry out. Carrying out proper hand disinfection requires learning and getting into the routine of following a particular method of applying the disinfectant, a method that's established as a European norm. The goal of the six-step method is to ensure that all surfaces of the hands are evenly covered with disinfectant and that no area of the hands is missed. Before application, the hands must be dry so that the alcohol is not diluted, which would reduce its effectiveness. First, press with your elbow to dispense the alcohol-based hand antiseptic into the cupped palm of your hand, and immediately begin to rub it in as follows. First, rub the flattened palms against one another. Then rub the backs of the hands and the spaces between the fingers by alternately pulling the fingers through those of the other hand to cover them with disinfectant. Then rub the hands palm to palm with interlaced fingers to cover and disinfect them. The amount of disinfectant required for a proper hygienic hand disinfection is 3 milliliters. Most dispensers are set to dispense 1.5 milliliters. A second pump full of disinfectant should be applied and rubbed in halfway through the required rubbing time. After this, interlock the fingers so that the fingers of one hand rub the opposing palm and vice versa. Grasp a thumb in the palm of the opposite hand and rub thoroughly with a rotating motion. Then repeat with the other thumb. Finally, move the fingertips of one hand in a circular motion in the palm of the other hand and vice versa, so that the disinfectant can get on the fingertips and under the nails. Germs, like the E. coli bacteria shown here, can only be seen with magnification, such as under a microscope. Under appropriate conditions, that is, in a warm, moist environment, they're capable of dividing and multiplying. In this animation, we illustrate, again with the example of E. coli bacteria, how the cell walls of the microorganisms are destroyed upon contact with the disinfectant. And also with this example of Staphylococcus aureus, we illustrate how the disinfection process destroys the germs and thus stops their rapid multiplication in its tracks. After the treatment with the disinfectant, only the amorphous debris of the destroyed cells remains, which is incapable of metabolizing or dividing, and is thus no longer viable. Our hands are often responsible for the transmission of germs. They are, in fact, the most important carrier. Who hasn't encountered the situation when painting that paint gets on your hands and then accidentally gets spread all over the place? The same thing happens with germs. Through contact, the germs get on our hands, and then by further contact are transferred to other places, if the hands are not disinfected in the meantime. This transmission of germs presents a danger for patients and staff, since the germs can multiply extremely quickly and, in particular for immunocompromised patients, can lead to serious infections and even to septicemia and death. This is why breaking the chain of transmission by hand disinfection is so critically important. This is particularly true for the microorganisms that do not normally reside on or in the skin of the hands, and that are pathogenic, that is, disease-causing, the so-called transient flora or temporarily resident flora. The source of these germs is often the patients themselves. Germs are found in infected wounds, or in blood, pus, or other secretions. The germs can end up on our hands and be transmitted by the hands to other places. That's why it's important to try to avoid contamination of the hands and thus reduce the risk of infections. Direct hand and skin contact with potential sources of germs should be avoided. The use of disposable gloves or of instruments using no-touch techniques protects us from direct skin contact with respiratory tubes, used bandages, soiled lavatory equipment, or bodily secretions or excrement. Of course, after a possible contamination, the gloves then need to be changed and the hands disinfected once again before going to the next patient. The risk is clear in the case of contact and transmission of, for example, MRSA, multi-resistant Staphylococcus aureus, and VRE, vancomycin-resistant enterococci. Patients that are contaminated with such bacteria are often helped only by a special antibiotic treatment. But even if these bacteria are multi-resistant to many antibiotics, this does not mean that they are resistant to disinfectants. Hand disinfection reduces the risk of germ transmission in cases of MRSA and VRE. The alcohol kills the germs in a matter of seconds by denaturing their proteins, and thus gives them no chance to adapt to a high alcohol concentration. In order to minimize the risk of germ transmission from potentially infectious sources, it's necessary to disinfect the hands after every possible contamination. That is, after contact with infectious or even potentially infectious materials, objects, liquids, or surfaces. This also holds true for cases in which one has worn gloves, because germs can be transferred to the skin through perforations in the gloves or while removing the gloves. The aim of hand disinfection is thus to kill or inactivate any germs immediately after the possible contamination event, so that they can't be transferred anywhere else. If, in addition to disinfection, the hands need to be washed, then they should be washed after the disinfection. One exception to this rule is in the case of heavily soiled hands, for example, ones covered with blood. In this case, the hands should first be carefully rinsed off, avoiding any contamination of the area or of the clothes. Then the hands should be thoroughly dried and then disinfected. Then any possible contamination to the area must be disinfected, and clothes that may have been splashed must be changed. Small spots that are soiled and possibly contaminated may be cleaned up using a paper towel that has been soaked in disinfectant. Then carry out the hand rub disinfection procedure again. The aim of hand disinfection before patient contact is to remove any germs from the hands that may be dangerous for the patient. The hands need to be disinfected once again before contact to the next patient, so that the transmission of germs from one patient to another via our hands can be stopped. In such situations, bedside dispensers or pocket bottles can be a great help in simplifying the access to and use of the hand disinfectant. Even the resident flora on our hands can pose a problem for freshly operated or intensive care patients. Potentially dangerous germs can end up on our hands through various activities, for example while eating, from touching other people or various types of objects, by blowing your nose, or using the lavatory. Even simply rubbing your hands across your forehead and through your hair can result in germs getting on your hands. That's why hygienic hand disinfection must be carried out before each and every contact with a patient, especially with particularly susceptible patients, but also before any invasive procedure, for example before drawing blood, inserting a catheter, or before a bronchoscopy or an endoscopic procedure. It's also essential to disinfect your hands before and after every contact with wounds, puncture points of catheters, drainage tubes and the like, since in all such cases it must be assumed that the protective barrier function of the skin is not maintained, and any germs that might be present can get into the patient's body. Hygienic hand disinfection plays a significant role in maintaining hygiene in hospitals. This is why it's essential that all physicians and patient care staff consistently perform hand disinfection so that germ transmission can be stopped as often as possible. Only in cases in which the patient care worker has an infection on the hand, such as an abscess or an infected dermatitis, are the hand hygiene and disinfection practices described here insufficient to provide ample protection of patients from infection. To protect patients in such cases, affected healthcare staff should not be allowed to carry out any duties with an associated risk of transmission of infection for the time during which they are affected. Hand washing should always be kept to a minimum. That means one should briefly wash the hands only when necessary, for example, at the start of a shift or when the hands become visibly dirty during the workday. Never use a scrubbing brush or hot water, since both of these can lead to skin lesions and loss of natural skin oils. For washing, never use a basic or high pH soap, but instead a wash lotion that's mild and gentle and adjusted to the natural pH of the skin. The hands should always be dry before disinfection. Disinfectants with emollients and ingredients that are moisturizing help to avoid skin problems. In addition, it's best to limit the time one wears gloves to the necessary minimum, and never put gloves on when your hands are wet. The alcohol must be completely evaporated first. Hands that are well treated and well cared for, and not overly stressed or irritated, can tolerate frequent hand disinfection. If hand care is neglected, or one uses a harsh disinfectant, the hands can become chapped, and thus provide an ideal environment for growth of microorganisms and be difficult to effectively disinfect. It's therefore essential to apply skin care products as required to keep your skin smooth, elastic, and healthy. Because healthy hands are essential for our work in caring for our patients.